You see that like backlit effect? It's like there's sunbeams coming. Also, something I'm sure the more keen-eyed have noticed is that my facial hair keeps changing between each one of these. I don't want to say episodes. Probably not the right word. I don't know why, but when I shaved this off and I looked in the mirror, I was wearing like a sleeveless because that's what I wear for pajamas because I'm from Florida, and I look like Freddie Mercury. I'm not sure if that's a good thing or a bad thing, but I mean, Freddie Mercury rocks. Who doesn't love Freddie Mercury? But anyway, since we're here, you want to talk about some Reddit? Okay, here we go. First question. I always love when I search for the ones in the Reddits that I want to look through. Some of them are very, say, catastrophized, but there's definitely a certain level of attentive. Like, I pay attention to the title. You're just like, okay, what am I expecting in this? But anyway, so this one reads, "Hello, everyone. Last week, I attempted a PR on the bench press and heard a clicking sound on the right side of my lower back. Since then, I've been feeling some uneasiness. I've continued going to the gym and working out without pain, although the discomfort comes and goes. Today, however, I suddenly felt an ache radiating from the right side of my low back toward the left side. At one point, I also briefly felt the ache in my testicle." That's an interesting additional bit of information there. "Although that has now gone away. I currently use a heating pad, which has improved the symptoms significantly, and I'm feeling much better now. What do you think the issue might be?" Anybody who's not super into, well, I guess you don't have to be like super into working out and all that. PR means personal record, which means that you're usually going for your heaviest lift or your heaviest weight on a particular lift. The bench press is a common one. It's a very common muscle to reach PRs. Like, it's usually like it's funny enough, it's kind of like a benchmark for how fit somebody is, just because the upper body is something that's very frequently worked out. And it's kind of a point of pride to a lot of men, or to a lot of people that work out in general. The bench press is a very complex movement when you really boil down all the muscles that are being used while you're doing it. So I personally love a PR on a bench. It's always a good gauge of if somebody's strengthening, because there's a lot of different muscles that have to move at the same time. It's usually interesting to see patients come in who are trying to PR their bench, and if they're having some kind of pain or if they're having some kind of difficulty, they'll plateau. Most of the time, I notice that there's going to be a weak link. The upper body can only be as strong as its weakest link, and a lot of times the shoulders can actually hold back a good PR push on a bench, just because your body's scared it's going to tear something. So anyway, but the point, I'm already going on a diatribe, but yeah, the bench press is a very important move for weightlifters, just because it's usually one of the first things people are going to PR, because everybody loves working out upper body. Or most people do anyway, men especially. It's a point of pride. Like my bench isn't like amazing, but every time I go up in weight, I'm just like, yeah, this is good. I'm doing something right. Yeah, all right. But anyway, so back to the question. When he felt a clicking, more often than not, that means that a tendon or a ligament probably was getting pulled on, and it might have strained it, or the other word that's currently escaping me, strained or sprained. There it is. Thank you, brain. It's always there to help me out. The strain sprains are important to treat differently than, like, let's just say a muscle spasm, because you can have a strain or sprain that isn't necessarily super painful if the tear or strain is not super excessive to the point where your body's scared it's going to tear. Because you got to remember what pain is. Pain is just inflammation. Pain is healing. I should say inflammation is healing. That's how the body heals. And pain is a component of that, but it's not necessarily the whole thing. And a lot of it has to do with like the thresholds of where we notice pain and all that. People who are a little bit more sensitive, that threshold tends to be a lot lower, which is fine. So some people can actually injure themselves and not have any pain, which is actually something that goes on in here in the chiropractic office quite a bit, because sometimes people will come in, we'll treat them a couple times, however many times it happens to be. Again, everybody's a little different, depends on the situation, and they might be out of pain, and then we'll still ask them to come in, because pain is not a very good gauge of the level of disorganization that's going on in the body, purely because, again, pain is just one metric. And I think, obviously, as I've probably stated multiple times at this point, pain's not a great metric, but other things will appear. Like discomfort is a good way to put it, because discomfort doesn't necessarily always mean pain. It just means something doesn't feel like right. That That's also another metric. Is it always reliable? No, it's not. And that's why I like metrics that are more number based. Like a range of motion's a really good example. So let's just say this guy was doing a PR, and he doesn't really say in the right side of the lower back. So while you're doing a bench, you actually do have to engage your core a lot. He might have been doing the tummy push-up. I might show a picture of that if I can find one. But sometimes when people do bench presses, they do this thing where they'll push their stomach up because it will make it easier to actually get it'll actually make it easier to get the bar down and up, because as you engage other muscles, your other muscles become stronger, I guess might be the word. Regardless, he probably did a push. He probably pushed his stomach up and strained, or maybe potentially pushed the disc, because the disc is just a big ligament, really, when you think about it. It's just shaped differently than a lot of other ligaments because it attaches bone to bone. That might be I might be mixing that up with tendon. I forget. One means bone attached to muscle, and the other one is like bone attaches to bone. I forget which one is which off the top of my head, but I'm sure I'll put it right up here. But when he was doing the move, he probably the pop in itself tells me that he pulled a ligament as opposed to a muscle. So how do you treat that? What does that mean? Well, when he comments about the testicle referral pattern, that's an interesting side note there, because of the fact of the way our spine works. The nerves that come out of our back, they all go to different things. So the way I think of it is that the brain is where the water. I think of it as water in a lot of ways. The brain is where the water starts. It's like the pool that's on top of the mountain, and it goes down the spine, out into the different areas of our body, and they have to follow particular streams. Everybody's a little different. Nerve pathways can be a tiny bit different on everybody, but most of the time when something's going on in the male and female reproductive system, it has something to do with the lumbar plexus, which is just a fancy word for the combination of spinal nerve related stuff. It's a collection of nerves, that's what a plexus is. And it's in the low back. Usually, I notice anything that happens in what they call a reproductive organ is usually sacrum. Sacrum has these little holes in it. Again, I'll try and show a picture here, where the nerve will come out, and it will stay in that pudendal area, which is the pudendum, which is the area between usually a reproductive area. The very bottom of the human. So between like the testicles and the anus is usually called the pudendum. That area, all those nerves come around. Usually, I'm sure, again, there's probably some exceptions, but a lot of times it comes out in the sacral area, which means that if a disc were to have popped, it was probably L5, because all the nerves of what they call the cauda equina, which is the horsetail, have to go through that area in order to get to the sacrum. Or if there was a ligament pulled, it could have been one of the many gluteal tendons. Although I'd be surprised if he did that on a bench. He must have really been pushing his back up. That would be pretty amazing. That'd be quite the push. But it could also be from the strain of, like holding his breath or whatever. Again, we don't know what the PR is. We don't know if he was lifting 150 or if he was lifting 400. That's obviously, you got to know the mechanism. You got to know the mechanism of the injury. In which case, that a lot of that stuff you would get in the history if this person was an actual patient. But it's just interesting to think about. The testicle referral thing is something that I think a lot of times when people go to chiros, they don't think about, where a chiro's a spine doctor. They go to us for the bone. We're bone doctors. Chiropractors are actually musculoskeletal doctors more often than not, I find, and there's a lot of neurology that goes on with the musculoskeletal system. A muscle can't move without a bone, and bones can't move without muscles. That's just how this works. And in order for a muscle to be able to work, it's got to have a nerve. If it doesn't have a nerve, then it can't do nothing. That's what a nerve is. You need a nerve to do anything, and it has to be attached to the body. In this interesting analogy, the waterfall does go both ways. So once it goes out, it goes there's a nerve that goes all the way out to the finger, and then there's nerves in the finger that go all the way back up to the brain, and that's how our body's able to communicate with itself. It's all through nerves. And so if anything happens to those nerves, if something rubs up against it, or inflammation is located in a way where it will interfere with the nerve's ability to function, it can manifest an outside problem, which is usually pain or inflammation or blah, blah, blah. So if I had to take a lucky guess at this, obviously there's a lot of, guesswork going on here without me getting my hands on this person. More than likely they did the bench press. They did something with their back they might not have were supposed to. And they either pushed their back up too far and they hurt their disc and or a lumbar or gluteal ligament. We could kind of determine that with more like hands-on examination. and the inflammation that's happening in that ligament more than likely is interfering with that nerve, and it's giving a bit of a referral pattern. Treatment wise, this would be this would be super conservative. I don't think this person would need a lot of like PT or anything like that. You get adjusted a couple times, make sure the muscles in the area are nice and relaxed. You just reduce the inflammation in the area and help with the healing, all that stuff. You can do like arnica, anything like that. Again, if you're having similar problems, make sure you consult your own physician and all that. I'm a chiropractor, but I'm not your chiropractor yet. There's a lot going on. The history on this is obviously incomplete in a lot of ways, but it is an interesting thing to think about, especially with that referral pattern. I think that's interesting. I think a lot of people don't think about that, and it's important for us to talk about it. So first comment. Hi, I am not a professional, so if you experience more pain, always consult the doctor, but nevertheless, here is my take on it. A click followed by discomfort can sometimes mean something got irritated or strained, right? Even if KT doesn't hurt badly right away, I'd probably lower the weight for now. Yes, that hurt. Yes, that hurt. Hurts my pride. Oh, my beautiful pride. Really focus on form and stability. Avoid PRs until it feels normal again. And since you mentioned the discomfort spreading and even briefly radiating elsewhere, I wouldn't ignore that if it continues. Yeah, for sure. If you're getting radiating symptoms, that means a nerve is related in some way. You don't want that to linger, for sure. And if the injury itself was severe enough and you don't get it treated, what will happen is the body's very clever. There's a couple things in this comment I'll address, but this kind of occurred to me. If an injury happens in the low back and it's not properly treated, what will happen is that the body will create a maladaptive movement in that you'll move differently, or you'll do your bench press in a different way and you're not even aware of it, because your body's trying to keep weight off of something, or it's trying to prevent yourself from injuring it further. And what will happen is that once the healing is done, if it's not properly rehabilitated, you will move that way from that point forward. Not always the case, but there's a very good chance that you'll continue to do that movement even when the tissue itself is all healed up and there's nothing wrong. And that could create a problem for somewhere else. You'll see a lot of times, I see it all the times with ankles. A lot of times people hurt their ankle and then they'll keep their weight off of it. Their other leg, usually it's like the knee on the opposite side will start to act up, because now all of a sudden you're putting a lot of weight on the other side, and they'll never really fully rehab the ankle because they think it's just a sprained ankle. What's the worst that can happen? Some people completely get over it, some people don't. Like I said, everybody's a little different. If you don't properly rehabilitate it and you keep walking differently, the knee might start just kind of constantly being this like weird issue, and you think to yourself, well, I didn't hurt my knee because I didn't fall or hit my knee on anything. What is the problem? I'm just getting old. That's an excuse I hear a lot, which to some level is true. I won't say it's not true, but when you're 26, I don't think becoming old is something I'd quite would say is the first culprit in that situation. But you got to think about these changes in your actual physical movement that you can, in a lot of ways, avoid if you get it treated early. That's why medical practitioners say that it's much better to get things treated while they're acute. You can avoid a lot of these maladaptive things that might arise if you get hurt. And his comment about the focus on form and stability, that is always what I recommend. I get a lot of athletes here. They want to not stop working out. I don't blame them. That's what they enjoy doing. And again, it's a point of pride to be able to work out and do the things you want to do. Whenever a athlete comes in, it's harder with people who do sports just because you can't reduce the strain on the body with sports if if they're determined to go out on the field or in the rink, whatever it happens to be. You always say you should give yourself time to recover, do some rehabbing just to make sure that the area is nice and sturdy. Whether they listen to us or not, that's up to every athlete. That's up to them. Personal choice is patient preferences is just as important to the healthcare paradigm as anything else, right? But if you are someone who's just lifting weights recreationally, what I always recommend is when you are injured, you don't need to stop, but it is very important that you don't strain it further. And at that point, I say go more for reps and go for a moment in time to just work on form to address any underlying issues. So if you're working on squat is a great example, and you do a squat and you hurt your low back, it's going to take a little time for it to heal. Any strain or sprain, usually speaking, takes at least a couple months to fully heal. The pain, if treated properly, usually goes away in about a month if it's properly handled. The full recovery of it usually takes about 2 to 3 months. And again, pain is not a good gauge of that because the pain is going to go away before the ligament fully heals, and that's just because of blood flow. Ligaments and tendons don't get as much blood flow as muscles. That's why a muscle tear usually is much quicker. It's usually a lot more painful too. But again, every situation is different. The way I like to look at it is it's an opportunity to improve your skill so that when you are able to start lifting heavy again, you don't have to worry so much about your the balance of the muscles in the area and your form. So in the case, like I was trying to say, with a squat, if you hurt your low back, let's just say you bulge a disc or whatever it happens to be, you could still do squats. I would either go straight to body weight squats or some kind of variant of a squat. Maybe do a I always forget, it's Bulgarian or Hungarian, the one-legged squat where you put your foot up on a bench and you do a one-legged squat. I find it's very important to do a unilateral exercise when it's an exercise that requires both sides. So like if you do a bench, it might be an interesting test to do not a barbell, but two dumbbell press up, and you'll notice that one of your arms might be weaker than the other. Because when you're doing the exercise, something that might have caused the injury in the first place is there is an imbalance in the muscles, let's just say in the pec, where when you're pushing up, your right hand is doing more, and one of the muscles down the chain of the spine or something like that could possibly injure itself because it's doing too much work and the other side's not doing as much. So, if you look at it, you could doom and gloom it, which because being in pain sucks. No, I'm not the first. I'm not breaking any molds here saying that being in pain sucks. But if you look at it more as an opportunity to get yourself ready for when you are able to lift again, that optimism, in my opinion, usually means you heal faster. People who are a little bit more chirpy tend to do a lot better in life overall most of the time. Optimism in itself keeps your body out of that like stressed fight or flight state, which you can't heal very well in fight or flight. I'm just talking. I'm just a big goofball. Sometimes I just can't. I don't know what I'm saying half the time. So if you're constantly in a fight or flight, the release of cortisol and stuff like that is going to prevent your body from being able to heal quite as quick. So generally speaking, being a little bit less stress-free does usually correspond with some quicker healing times. I'm sure there's some exceptions, but that's a good thing to think about. Let's do another one. This one's a bit long, so don't fall asleep. I don't know how you can fall asleep. It's actually kind of, I don't want to say exciting, but it's very action-packed, I guess. So, ready to give up. I've been dealing with this for 1.5 years. The first year wasn't bad enough. I couldn't work, although I was very limited. For the last 6 months, I haven't been able to work. Most days it hurts to walk or sit down. It's weird because some days if I endure the first 30 minutes or so of sitting down, I can stand up for a bit and sit down without much pain. Then I start over the next day. Although sometimes I'm in more pain the next day due to doing too much the day before. I went in for an MRI 2 days ago, the first one they have given me for some reason, and had to walk a very long ways into the hospital. I was miserable the whole way. As soon as I made it to the doctor, I was taken in a wheelchair. You think they would? Well, I guess they can't meet you at the wheel. They can't meet you at the front with a wheelchair, I guess, unless they know you're coming. That's tough. I'm sorry, man. That stinks. Or woman. Even being in the wheelchair, I was miserable and never found any relief. Even after laying down for my MRI and being wheeled all the way out to my truck, I was still in extreme pain. As I stated earlier, I usually stop feeling as much pain after about 30 minutes of sitting down. This time was different. I drive home and barely was able to make it up to my second-story apartment and into bed. The only place I have felt full relief is laying down. That's important. And have been taking steroids for the last 2 days and still in pain even while laying down. I can barely stand up long enough to urinate, and when I do, I'm in extreme pain. I have a video meeting with my doctor tomorrow to go over my results from MRI. In my previous appointments, my doctor was kind of has kind of dismissed my pain. They did x-rays a couple times and said everything looked fine. I've seen my results on the MRI, and they've written in verbiage that I can't fully understand. But I do know I have multiple issues with discs, especially in the L1, L2 area. The last time I spoke to my doctor, he basically told me that I was too young to do surgery. I just turned 35. That's good to know. Age is a very, very important part of the history. And that I needed to lose weight and try to do what I could to help fix it by doing things like rehab. Of course, that's pre-MRI, and when they couldn't tell anything wrong on x-ray, I'm at the point... Of course, that's pre-MRI when they couldn't tell anything wrong on x-ray. I'm at the point now that I can't even sleep due to being in pain laying down, and I'm losing all hope. I have been relying on family to pay my bills and have been holding off on disability with the hopes of this passing, but the hope is now disappearing. For the last 6 months, I have found my only real relief being to lay down in bed at night and now that has been taken from me. I'm having trouble reading. Sorry. My brain. I feel so bad for this person. I'm like, oh gosh. There's a lot of stuff. I'm just thinking. Really need some positive input or advice to help keep me going. Sorry for the rant. This is miserable. All right, multiple things here. I'm very sorry that you've had to deal with this. It's in our sciatica. It doesn't sound like he had sciatica. It just sounds like he has a lot of low back pain. Again, sciatica is, in my opinion, a very particular maybe not particular, but a very kind of, you see the series of events that it creates, with the pain going down the leg. Not all low back pain is sciatica. That is something I hear all the time. People come in and they say they have sciatica, but whatever. It's purely pedantic. I don't know. Maybe that's one of my just weird pet peeves. That should be another shirt we make on here. It's like, it's not sciatica. Regardless, I'm sorry to hear that you're going through this, even though it's not sciatica. It's or it could be. I don't know. It could be. I didn't get the full case. It's miserable, and not being able to do the things you need to do just to survive. I usually always talk about like, oh yeah, if you enjoy doing this thing, but if you can't even do the basics of going to the bathroom, like that's miserable. Nobody wakes up hoping to do that kind of stuff. And for you to be suffering this for 1.5 years, it seems like the first year wasn't so, it was miserable, but it wasn't so bad that you were being disabled by it. And then you say for the past 6 months, it's been especially bad. That right there is interesting, just because of the fact that you've been willing to deal with it for 1.5 years, and you've been trying to kind of tough through it. One of the comments in here is, you're saying like, you're just hoping that it'll pass and you don't want to take the disability. I think it's a very common American, especially male. You see it a lot with male patients are constantly like, yeah, it's been bothering me for 12 years and I just kind of ignored it and blah, blah. And then eventually there's a point where you just can't do anything anymore. One of the wisest things I ever heard, I'm always going on with my idioms. I don't know if that's the right word. I think it's idioms. If you don't make time for your injuries going to make time for you to heal. If you don't make time to heal, your body will make the time to heal. And it sounds like that's what's happening. Because again, what is pain? Pain is inflammation. Pain is healing. That means your body's acutely aware of something going on in that area, but it's not able to heal it quickly enough where whatever's causing it to be, I guess, like damaged. I'm not sure that's the right way to put it, is able to keep up. So you are hurting it more quickly than your body's able to heal it. Now with discs, it's tricky. Discs, once they go out of place, can become a very firm resistor of motion in the low back. So you say that, you sit down for 30 minutes, at least before the past 6 months period. It sounds like that that's been getting worse too. Sitting is interesting because you would think that if it was disc related, that might actually increase the symptoms. That's interesting that makes it feel better, which tells me that it may be leg muscle related, because if you're standing up, tight hamstrings and tight quads can pull on the low back. There's probably a leg component to it, which might be causing the discs to over move, and that might be creating a lump, like a herniation. You say that you have some kind of issue with L1, L2 area discs without any like super specifics, which is fine, because again, you said that you couldn't fully understand it, which I would like to advocate. When you go to the doctor and they explain these reports, you make sure you get it. Like, they're there to tell you these things. If they're not willing to explain how a lot of these things work to you, then they're probably not aware that you need to know, or they're being like blatantly, like they're being rushed or whatever. There's probably a million different factors. But when you have the doctor's attention, just ask the question. Don't think you're going to seem stupid or that it's a question that's not worth answering. Because again, if a question getting answered brings you some kind of peace of mind, I think it's as important as a question that might be like very scientifically complicated and blah, blah, blah. But if you just ask a question and you're like, it just like takes some stress off of your mind, that is worth it, in my opinion. And I think you should ask those questions. So yeah, there's a lot going on here. So it does seem like a disc. It's weird that if you went to a medical doctor that they didn't go for the MRI over the course of 1.5 years. This guy does seem, I agree, he does seem a little bit dismissive of your pain. You're 35, which is pretty young. Most disc-related issues actually, funnily enough, happen before you reach the age of 40 because of the way they're they're more fluffy when you're younger. And if somebody's going to have a disc problem, I think most of the time they're going to have it between like 20 to kind of like maybe early 40s. Then when you get to the 40s age, your discs tend to shrink to the point where if you're having a problem in the back, it's not usually disc-related. Of course, there's always going to be exceptions. And then you start having disc problems again later when you're probably like in your 50s, late 50s, like 60s, because your discs have shrunk to the point where there's like arthritis in your back because now your back isn't able to move quite as effectively because the discs aren't as big. You see that a lot. I think the demographics probably support that unless some change in research has popped up since the last time I looked, which has been a little while. Obviously, it's not something I check all the time. But I will say that it does sound to me like you're having a disc problem. All that stuff sounds disc-related to me. Weight being a factor, I don't know how heavy you are. The discs are purposely made to fight gravity, so weight is always going to be a factor. Is it the only factor? No. And I do think that, and I think I've said this in previous videos, that weight is more than likely overvalued as a cause of issues. I think from a lifestyle standpoint, and again, overweightedness is such a hard thing to just speak plainly about, because there's a lot of genetics, there's a lot of lifestyle factors. But when somebody sees somebody overweight, I think there's a immediate reaction to think like, oh, maybe this person's lazy, or all they do is sit around and eat potato chips and Cheetos and all that stuff, which is obviously not a fair assumption to make. I know plenty of people that work out all the time who are just a little bit on the fluffy side, and that's not a bad thing. But no matter what, having weight does put more strain on your joints. I do think that is an inarguable fact. So losing weight will make you feel better from a gravity standpoint, no matter what. Whether you can lose the weight or whether it's your fault that you have that weight, that's an entirely different discussion. And it's probably beyond the purview of what we're talking about here. I'm not here to be the moral police or whatever. But if you lose weight, you probably would feel better in a variety of ways. But there's no way you can lose weight if you can't even stand up to go to the bathroom. So in my opinion, I might be a little biased. Again, I'm a chiropractor, but I'm not your chiropractor. If this person, I were to bump into them on the street and they told me their life story, I would say, well, why don't you just go to the chiro? This is to me, this is like a chiro case. This is like bread and butter chiro right here. This is bread and butter. Person with disc problem going to a chiro to get treated, however that chiro decides to do it. I think a good adjustment in that area. The first couple ones are probably going to be pretty uncomfortable or potentially make you kind of achy afterwards. But if you stick with it and the chiro is doing all the things that he needs to do, I have a distinctive feeling that as soon as motion is restored in that low back and the nerves themselves are not as compressed from, let's just say, a herniated or a bulging disc, I think you would feel better. That's my opinion. Do I know all the facts? No. But if they came to my office, that would be exactly what I would think. And, I have stated my opinions thus. But again, if you're experiencing this kind of problem, don't just listen to me. Go to a physician or go to a chiro or go to a PT. We're all great for the most part. There's probably bad ones out there. Don't let TV poison the well, shall we say. But yeah, I do think an MRI showing that you have herniated discs, like I said, X-rays and MRIs and all that are very interesting from a standpoint. I did an episode before where I talked about X-rays and some of the value of them. I do think X-rays are very valuable, but I don't think they necessarily always tell you the full story, but they do definitely offer you an interesting shot of what could be possibly going on in there. Is it guaranteed that the discs are causing all of your problems? No, which is why I think it's important to get a thorough exam from somebody who maybe focuses more on movement-based stuff, because it does seem like movement is what's causing you a lot of issues. If you came to my office, I would sit you down and be like, what movements in particular cause you the most amount of distress? Does it hurt when you spin? Does it hurt when you tilt? Does it hurt when you bend over, going backwards? All these things are very important and interesting clues. If you lay on your back and then I move your leg around without you moving it yourself, does that cause the pain to increase? That means there might be something in there that's not that inside your hip that's not moving correctly. All that stuff is very important to know when it comes to a disc problem. Now, I could say from personal experience with patients who have had some issues with L1, L2, a lot of times I find that in the TL junction, which is what we call the thoracolumbar region, which is where the mid back becomes the low back, it's what they call a transitionary zone. I find a lot of times if there's a disc problem in that area or muscle related, a lot of times, again, I made a comment about it earlier, I find a lot of times it's leg related because of just the way the body works. If the low back gets super locked up, it will move its way up and the low back will become kind of like this big brick. And in your case, if you don't have the discs in the right spot, your body's going to do everything it possibly can to make it so you can't move on those discs, which might potentially cause it to get worse. Your body's smart. Your body's doing everything it can to protect you, but that doesn't necessarily mean it's going to feel good in the process. So I would say the first thing I would check, again, making kind of just a very quick judgment call, I would stretch the legs out to reduce the amount of restriction that's happening in the low back so that the nerves can get freed up, so that the spinal nerves don't feel as compressed. Because as soon as the spinal nerves get freed up, muscle spasms and all that tend to follow behind, because the muscles are guarding your nerves from other physical components from squishing them. You can call it a pinched nerve if you want to. There's a lot. This person's obviously in a lot of distress. I think that would also be a main component of treatment. Is like, let's talk about it. Like, sit down and what about this is bothering you? Let's make goals. Let's have easy to achieve goals so that you can feel like you're making some progress. Does it have to be complicated? No. How about we just say more often than not, let's get a day on it. Let's just say like every other day, I noticed that the pain is better. Or it could be even as simple as over the course of the week, I'm having more good days than bad days. What does that mean? Well, we talk about it. Are you able to, like, you can drive your car more? You're able to go to work. Maybe you're still on a lifting restriction. And, you know, and a good chiro can even write a doctor's note to be like, hey, he can't lift anything over 20 pounds, whatever. Again, there's a lot of leeway here. And there's a lot of personal preference from the doctor. And again, I think patient preference is a huge part of that. But yeah, I'm really sorry to hear that you're going through this much stuff. It sounds miserable. I'm really sorry to hear it. I hope that it does get better. I hope you try chiro. I think chiro would be, this, like I said, this is like chiro bread and butter. Especially if they've taken the x-ray and the MRI and there's no red flags. There's no, like, you know, there's obviously no, like, broken bones or anything growing where they're not supposed to. In my opinion, this is like chiropractic bread and butter. However they want to treat it, that's up to them. As long as they get better, I would be happy. Let's read some comments. First comment: don't give up. Couldn't agree more. And try creatine. It lubes your joints and helps with back pain. I thought I would never get better. I started creatine and a few other supplements and quit my muscle relaxers and anti-inflammatory. I started healing a little bit faster. I can walk so much better. I still have bad days where I can't move without excruciating pain, but I'm getting better, something I thought would never happen. That's interesting. I am not an MD, and it is beyond my scope to ever talk about medication and if you should or should not take it. Anti-inflammatories are important for a variety of reasons. Muscle relaxers also can be very important. And when you think about why people take these medicines, a lot of times an anti-inflammatory is there to help you with the overcoming the pain, and muscle relaxers are there to help you loosen up in a way so that your body's able to heal it. So if you think about, like, at least from my viewpoint, if you take these medications, they're mostly there to help facilitate your body's ability to heal a problem over the course of a period of time. A muscle relaxer and an anti-inflammatory in themselves do not fix a problem, but it allows you to survive, I guess is a nice way to put it, so that your body itself can fix it on its own. And a muscle relaxer is there to help you. It helps with muscle spasms, essentially, because muscle spasms can be miserable. Why you have muscle spasms? Well, there's a variety of different reasons. It could be a disc or whatever. If you have a muscle relaxer for a disc problem, it could be that your muscles are so tight that they're pulling on the joints inappropriately, which is causing the disc to bulge. And if you are on a muscle relaxer over the whatever amount of time, it could help the disc heal itself. The body would heal it. That's what that's for. And anti-inflammatory is very similar. An anti-inflammatory goes in there and it reduces the things that float around inside of your blood that initiate and procreate an inflammatory environment. Healing is inflammation. So, you know, anti-inflammatories are interesting that they help with pain, but, you know, I'm sure there's some research out there that suggests that it might slow down healing in some ways. And that's fine, just because of the fact that if you could sleep through the night, listen, you're going to heal a lot better if you could sleep through the night as opposed to not sleeping through the night, no matter what you do, right? Just think about what those medications are for. Again, that's beyond my scope. I will never tell anybody that they should or should not be on whatever medication, because, like, again, that is way beyond what a chiro should be realistically talking about in a lot of ways. We should educate, but we should not demand, and we should not force our opinions and our values onto others. If somebody gets a lot of relief from a muscle relaxer and they don't want to get off of it, that's their call. If their medical doctor states that they should be on it, well, then I'm going to trust them. And, you know, that's all you can do. That's all you can do in this world anyway. But yeah, so there you go. That's 2 questions. So we got a little bit more time for this episode. Let's do a daily stoic meditation. Again, I have talked about it in previous episodes. I'm a huge fan of Ryan Holiday's Daily Stoic. He is a publisher, writer that talks about Stoic philosophy quite a bit. He focuses a lot on Marcus Aurelius and stuff like that. A lot of stuff that's personally helped me out a lot in a lot of like situations. If you talk to anybody who's close to me, I'm usually quoting Marcus Aurelius or like, you know, Chrysippus or, you know, whatever other like Stoic philosopher that I can remember at the time. But a lot of it keeps me grounded, and it reminds me that no matter what happens in life, you know, you can, you know, there's something you can learn, and especially being in control of yourself, I find is very, very important. And again, I think the emotional component of how people feel is just as much of a part of chiropractic as the physical part and the diet part. That's just my personal philosophy. If you don't like this stuff, that's okay. You can end this episode here, but that's fine. If you do or don't like Ryan Holiday, I know he's got a lot of haters out there, which I don't know, whatever is fine. You know, he writes great books. I've always been a fan of him, and I would highly recommend you go subscribe to him, or, you know, listen to read his books or whatever. I don't get anything from him, and, you know, I think trying to educate yourself can only make you better. So, you know, the worst case scenario, you're not interested. That's fine. Anyway, this email reads as such: it can be an ugly world. It can be a boring world. It could be a world full of distraction. which is why the artist and the philosopher must learn how to cultivate with their eyes. In 1940, the writer James Baldwin was walking in New York City with the painter Buford Delaney, his friend and mentor. As they crossed the street, Delaney stopped the young Baldwin and said, "Look," as he pointed down into the gutter. "What do you see?" All Baldwin saw was a puddle. Delaney told him to look again. This time Baldwin saw, as Nicholas Boggs recounts in Baldwin, a Love Story, a reflection of buildings moving like mercury in the gutter's black water, distorted and radiant. It is clear in Meditations that someone did this for Marcus Aurelius. See, look at that. He mentioned him. He always says it at least once. How else can you explain his beautiful observations of seemingly ordinary and even unpleasant things? From the way an olive rots on the ground or the foam flecked on a boar's mouth. What else could explain not just his turn of phrase, but his ability to find philosophical truths and his own struggles as a human being? Perhaps it was Rusticus, his philosophy teacher, who taught him this, or Fronto, his rhetoric teacher, or some poet or writer he met. But in any case, as Baldwin said to Delaney, the reality of his seeing caused me to begin to see. And so it goes for us. We must cultivate the ability to see beauty and poetry everywhere, because it is everywhere. We must look into the gutter. We must change our aperture and perspective so that amidst the muddle and puddles of life, we could see what the artist and the philosopher sees. So this reminds me of a story that they tell in Buddhism, where the Buddha comes across a river. And I might be telling the story a little wrong, but the general gist of it is, he comes upon a river, and he says that when he crosses this river, if he were to ever come back this way, or even like every step of going through the river is now different. The river is never the same for the entirety of its existence because of the fact that it is moving. It's a moving source of water, which means that every single time that he comes to this river, it's going to be slightly different. And humans are the same way. Humans go through their lives and they learn. And I believe there's a Jason Mraz album, which is We Live, We Love, We Steal Things, I believe it's what it's called. It's a great album. Saw it live. It's great. Jason Mraz fan here. But it goes to show you that as humans live their lives, they're going to be hurt by things. They're going to start liking things. They're going to have different perspectives on things. And all of this can happen either very, very quickly or it can happen very, very slowly. But the one thing that never changes is that things change, right? That's just the way it is. So if you see something in the world, what you should do is you should appreciate it, because in any amount of time it could no longer be there. So trees eventually will die. The seasons will change. The building that you live in will get older. Electronics will start to break down. It's all these different things that we take for granted that, to me, and this email is probably is talking more about like seeing the beauty and the ugly things, which is also important. But it reminds me to really appreciate the things that I do have, because eventually I won't have them. And if you can stop and appreciate the things in your life that even like might bring you some kind of misery, it goes to show you that you're a more durable human being. Because if you can learn to love and appreciate the things that make you not happy, then you can definitely start to appreciate the things that do make you happy. But that's just me. So I say go out there, look for something that maybe you maybe underappreciate, or something that really bothers you, and try and look at the positives of it, right? Sometimes it's the devil you know. I was actually thinking about this while I was walking around downtown Lexington, that there's a, I'm not going to name any names, but there's a company out there that really just steams my shirt up, makes me uncomfortable under the collar. And to me, I'm not a huge fan of the company, but there's like thousands of people that do like this company. And I thought to myself, well, hey, what a great way to kind of separate me from the people who do like that kind of stuff, because maybe we don't get along, or I won't appreciate the same things as those people. So maybe it's a good thing that this thing does exist, because what it does is it gives happiness to other people, to something that doesn't bring me happiness. But what does it matter to me? And that's something that made me smirk as I was walking around downtown. But obviously everybody's gonna be a little bit different. Go find something that makes you miserable and try to see if you can force it to make you happy. You might change your life. So anyway, that's enough for today. Thank you very much for listening to this. Keep it popping out there. We'll see what the facial hair looks like next time. Looks like I need to shave. I don't know. I still think I kind of look like Freddie Mercury. Maybe not when I'm dressed up nice, but Freddie Mercury rocks. Anyway, I'll talk to you guys later.